Good morning, ladies and gentlemen. Today we'll touch a problem which is concerning for any of us, whether they are from the medical side or as a parent or even as an educator or even as a normal person. We will talk about an important problem that may face a significant portion of the population. And by the word significant, I mean it either the number or the effect. So today we'll talk about the child abuse in a specific age group, which is a preschooler before the age of 6 years. And we will explain why I chose this age in the next slide. So the title is Protecting Our Little One, which is covering how we can discover the signs of exposure of some of our precious children for abuse in the different forms of abuse, sexual abuse, emotional abuse, or other types. And I will cover the following objective: how to understand what constitutes the meaning of the child abuse and the child neglect, how to recognize the early sign of the abuse in this specific age group, and learn what we should do when we face such case, and to build what we can say collaboration between the parent, teacher, physician for ensuring a safe environment for our precious children. So what is the meaning by the child abuse and neglect? So the child abuse or neglect, it refers to any action or even lack of action. So it is either we do an action or we didn't do the needed action, which should be done by the caregiver, that result in harm or even potential harm or even not only harm, the threat of harm for a child. So not necessarily to induce harm, but even the threat to induce harm is a form of child abuse. So there is different type of the child abuse. Of course, in the physical one, all of us, we know about it. The sexual abuse also is well known. We also have what we call the child neglect, the emotional abuse, and there is a specific group called also the medical abuse. So the physical abuse is the intentional physical harm, for example, hitting or burning the child. The emotional abuse is inducing harm for the emotion, for the psyche, and the well-being of the child, for example, by constant criticism. And the sexual abuse, of course, it is inducing inappropriate sexual behavior or involvement of the child, for example, touching, exfoliation, or even bad verbal word also is a form of sexual abuse. And neglect is a failure to meet the basic needs, which means that the family are not providing the children with the necessary form of care. But what I mean here is if they are able to provide the care, but they didn't provide the care. I don't talk about the poor families that are not able to provide the necessary. This is not a neglect, but it is poverty. This is a little different topic. The best one is the medical abuse. I will not talk it because it's a specific syndrome by its own, but I can explain it. For example, some of the mother can induce some harm or inducing a specific disease, for example, giving some medication for their children to induce specific symptoms so that they can ask or request specific care from the family or from the physician. We call it Marchinson syndrome by proxy, which means that the family can induce some diseases in their children. What is the aim of that? To ask some sympathy with the family. Okay, this usually occur in mothers are, for example, a single mother or divorced family or broken family to request sympathy from the surrounding, or even to escape the bad environment from the house, so that the child would be admitted in the hospital by inducing specific symptoms, for example, giving him some medication to induce diarrhea, or vomiting, so the child will be admitted to the hospital, escaping the bad environment from the house. We call it Murchison syndrome by proxy. This is just a helicopter view for the child abuse. Now we will talk about why I'm targeting this specific age group. Why in the preschooler? Why? Because for a lot of reasons, one of them is this age group have a limited ability to express themselves. They are not able to verbalize in a normal way or to express what they feel. And also, they have a high independency ratio on the adult for their basic needs and high level of trust. They trust the surrounding, they trust the caregiver, they trust the mother or the father, or even the nanny or even the teacher in the preschools. By the way, the younger the child, the more the child will be vulnerable to the effect of the child abuse. And if we have a look for this number, about 1/4 of the children will have some form of abuse in the first year of life. Meaning 25% of the children breed the age of 5 years will have experience with a form of abuse in the first year of life, in the first year. Okay? And this will have a cost nearly about 124 billion each year for the cost of management and handling such form of abuse. You imagine the number, 124 billions per year, which is equal to the economy of one country. So we'll start with the physical abuse, and the one of the examples that we can see in the pictures, presence of unexplained bruising or burning or injuries in the child, which, for example, the bruising will take the shape of a specific object, for example, the belt or the hand on the face, for example, for slapping. Present of specific forms of burns, for example, the cigarette burn, or even the spoon. Some of the families, like in they may eat the spoon and burn the child, or present of different fractures or joint dislocation without a meaningful reason for that, so that it can also hint the exposure of the child for a form of physical abuse. For an example, if you look to the chest X-ray, you would find multiple fractures here, multiple fractures, as I pointed here in the arrows. And also, if you can see here, this is angulated fracture in the hip with dislocation of the shoulder. You can see that the humerus has also fracture here, and there is wide gapping of the joint here. This is dislocation of the shoulder joint on the left side. Presence also, you can see that the heart is shifted to the right because of the air in the left side due to fractures, multiple rib fracture with injury of the pleura. And you can see here also there is fracture in the right and fracture in the left side. So other example here, you can see that here is a fracture here. You can see there is also multiple fracture in the skull here also. Here we can see 1, 2, 3 fractures, multiple fractures. In such age also, which the child is not even walking. So how can a child in such age have such type of fracture? So there is high incidence of being exposed to child abuse. Of course, this is not related to accident, but it is related to abuse. So this is for the physical finding, but even we can detect the child abuse by specific behavior from the child. For example, the child may have a severe fear reaction when he is touched by someone. Not necessarily to be the person who committed the abuse, but even for any person, if any person comes near to the child, he will have an exaggerated fear response because he is scared for anyone. Okay, so not necessarily this fear reaction from the committed person, but also for any person, but it will be much higher fear level when this person who committed the crime will be near to him. Also, the child may feel a reluctance to engage in different physical contact with any person, especially for the adult, because of the fear inside themselves. So, an important note also is that the child is going to the nursery and the child is refusing to go back to the home, will also may reflect that the child is exposed to physical abuse in the house. On the other side, if the child have cry a lot and not a normal way, because many of the children will cry to go to the nursery, but I mean here an abnormal response. The child was happy to go to the nursery and suddenly start to have fear reaction or excessive crying when he go to the nursery. It also can explain why. Can explain that the child may be exposed to some form of abuse. So other possible signs, like for example, if the child is keen to wear long sleeves in a very hot weather to cover the injured part of his body, and if we examine the child, we found that the child may have different stages of wound with healing, so that one wound will be from 1 week, one wound will be more than 1 week, and so on. So the different stages of healing for the injuries is also suggested that the child is exposed to continuous and ongoing abuse. So there is a lot of red flag that we can help us to detect the child is exposed to abuse. For example, a child who should should have the developmental stage to start to walk, and the crown is not crowned yet, or we have a visible and severe injuries of different level of healing, and there is a specific form of injury, like for example, a specific shape of, for example, spoon or belt, and so on. And when we find the history is matching with the symptoms. So the timing and the history of the injuries are not matching the age of for example, of the injury or the severity. For example, the mother will say the child fell down from the carpet, but he has different fracture and with different ages of the fracture. This means that he is exposed to abuse and not just an accident. Another form of abuse, which is the emotional use. The emotional use is not using a physical force, but can use abusive words. For example, continuous criticism for a child, continuous threatening of the child, using abnormal work, abnormal behavior, or putting the child alone in a separate room, or not talking to the child. This is a form of delayed of emotional abuse. One of the important features for the emotional abuse is the delayed emotional development, or on the other side, exaggerated emotional development. What I mean with that is the child, for example, is struggling with doing a specific task that it is should be done at such age. For example, refusing to play with some of his peers, his colleagues, lack of emotional response for a situation that induced some happiness. So when I asked them to do something good, or to do, suppose for example, going to a nice place, he will not feel happy. He will feel that he's still sad, he has a lot of fear, and so on. Or on the other side, the show premature emotional development. For example, a 5-year-old child will have the more mature enough to take the action of the parent, for example, because participied behavior. So the child, this child with the 5 years, is taking care of her younger sister or younger brother. So because of what? Because of the emotional abuse. So it is a bit overly mature, or what we call it participied, taking an adult role and adult responsibility. This also may reflect exposing the child for a form of emotional abuse. Of course, it's not in all cases, but this is like a red flag that we should put in our mind. So lack of self-confidence and self-esteem with extreme anxiety is also, it can reflect the exposure of the child for abuse. For example, he's all the time saying, I'm bad, I'm not good, I can't do anything right, I'm the reason for this situation, I'm the cause of the darkness in the world, I'm the evil one, and so on. This is also, he's scared to try a new activity because he is scared from having a potential failure that may expose him for a potential punishment. We also, this form of abuse can be reflected in hospital. We call the psychosomatization, where the physical symptoms can appear. For example, has a frequent abdominal pain, stomach ache, headache. It's also related to emotional abuse and related anxiety in response to this form of abuse. So another form is that child is trying to withdraw himself from any activities, from the society, from the nursery, from playing in the playground. It also can be reflected in a different way, that this child who have emotional abuse will express his abuse in the form of another abuse for the other children. So he will hit, he will bite for using harsh, bad words for the other children. mimicking what is happening to him in his house or in the community that he's living. Also can be reflected by delayed speech or frequent tantrum, or have a defiant response to a minor trigger. So he has a lot of anxiety when exposed, for example, somebody asking him to do something. He will start to shout, he start to cry. This is also can reflect that he's exposed to a form of a child abuse. So what are the long-term effects of psychological emotional abuse? Actually, this can explain a lot of the psychological problem that can happen in the adult age. For example, they are more liable to have anxiety, depression, also social withdrawal. Also, they are more liable to commit crime or even to be a drug abuser and alcohol dependency. They are more liable to have a teenage pregnancy and sexual experience and sexual related health problem. But also, it is a very important for a hidden problem, which is maybe explain why he has an impaired brain development in the different forms. For example, the problem in the learning activity or in the speech ability and different forms of brain development. So this is a real scenario, which is a child who have a 4-year-old becomes very crying with a lot of tears whenever asked to participate in a group play. This is an activity which should make the child happy. Unfortunately, he starts to cry or she starts to cry, and he or she is insisting, saying that I'm not good enough to participate, or the other side, they are not good enough to play with me. So what could this behavior indicate for you? This is a red flag or an alarming sign. Another form of abuse, which is the sexual abuse, and you will cannot imagine what is the frequency of the sexual abuse. So one out of four girls, which are about 25% of the girls, I'm not talking about the whole female, but about a specific age, 25% of them will expose to sexual abuse. And not only the girls are liable for sexual abuse, but also the boys, which 1 out of 6 boys may have exposure to sexual abuse before the age of 18 years. And unfortunately, not like what all the people are expecting, that the sexual abuse will be committed by the stranger. Only 10% of such sexual abuse will be from the stranger, and about 90%, which is 9 times of the children, 9 times of the committed person who commit the sexual abuse from the circle of trust surrounding the baby, like the parents, the families, the uncles, the nannies, the teachers. So they are from the trusted zone and not a stranger. So what are the key warning signs of the sexual abuse and the preschoolers? Behavior indicator, for example, the child starts to use abusive or sexual word, which is not matching with age, or have a lot of knowledge about the sexual act. Also may explain that he already exposed to this sexual behavior before. Also, he becomes so scared from a specific person or going to specific places without any specific reason. And also, it may explain with sudden withdrawal of the child, or sudden fearfulness, or excessive attachment to the mother, with a very strong fear reaction when going near to a specific person or going to a specific place where the crime was committed. Physical indicator, for example, if the child has exposure, we have a frequent finding that the child may come to us in the clinic complaining of fecal incontinence. It also may have a problem in difficult in walking or sitting because of the injury for the genital area. Also, with physical examination, we may find if the sexual abuse was recently, we find pain, redness, swelling of the genital area, frequent urinary tract infection, unexplained bedwetting, and also fecal incontinence in cases, especially in boys, or also even in girls, because of the anal sex, that can be also caused by exposure to sexual abuse. So emotional finding also that suddenly change in the mood, for example, very intense anxiety, anger, action, sadness, or fear without an explained reason. Lots of interest in a specific that the child was previously enjoying start to hate this activity, because it may expose him for getting near to the abused person or getting to the place where the abuse was committed. It also may appear with a regression of specific tasks and behavior, such as when the child has a urinary control, he starts to have bedwetting or start to have thumb sucking. This is also a form of an anxiety, reflecting the intense fear that the child tried to forget by using this thumb sucking. So sexual abuse, the abuser himself, he will access the children where there is the weak area of protection, or we can say where the protective barrier are low. So for example, the area of the house or the area of the school where there is no, for example, camera that can discover this. It may be, for example, in the toilet. The protective barrier in the child, in the school, for example, in the school environment may be weak. It's not strong enough. So this area will be the target place where the abuser will commit the crime. There's also ongoing failure to address this issue will increase the risk that the children to have a problem during that specific school or specific program. Unfortunately, the abuser doesn't have a specific feature that it can distinguish this abuser from the normal person. You cannot imagine that maybe a very high-ranking people, for example, professor in the universities or parents or uncles or very prestigious people. And as we know that Epstein class with the highest level in the whole world are committing that crime. And now it is called Epstein class. These abusers are maybe professors, maybe genius people. They come from all the segments of the society, and they may be married, maybe president of some countries, they may be ministers, and we can't know what is happening in the world right now. And as I mentioned before, 90% of the abuse will be from the trusted zone around the child, and only 10% of the sexual abuse will ever encounter a criminal justice system, and about only 10% will be exposed for responsibility in front of the court or for the legal system. Another form of the child is a child neglect. What we mean by the child neglect, it is means that the family, the parents or the caregiver are not able to provide the normal care that the child needs despite the availability of the care. We are not talking that their inability to provide the care because of lack of, for example, of fund or lack of ability. But if they are able enough to provide the care and they are not providing it, this is the child abuse. However, there is many risk factors that may expose the children for this type of abuse. For example, if the child or the parent are drug dependents, they have substance abuse. They may also, for example, if the parent has some mental problem, for example, depression or anxiety or obsession, maybe also personality A, which is very easy to trigger a person, very easy to have a strong abnormal action. Poverty also is an important cause of neglect and lack of knowledge or the skill of parenting. For example, a new mother or new parent also may put a child for a child abuse. For example, the mother is not well trained for the proper care. They also may provide a neglect without being aware that they make this type of abuse. So the impact of the neglect can induce some physical consequences like exposure of the child to nutrition deficiency, for example, so it will have a chronic illness, poor immunity, and also it may be an important reason for the developmental delay. For the emotional effect, the child be exposed to the low self-esteem, difficulty in forming friendship, attachment, and also long-term trust issue. And it also could be reflected for the school achievement and educational progress. The child will be falling behind the academic readiness compared to his peers due to lack of stimulation or due to the frequent absenteeism from the school because the parents are not care enough to provide the necessary care. So what are the key signs of neglect that we can discover in the school? For example, if the child has a poor hygiene, he all the time come to the school in a very poor dress, not clean the dress, tear the dress, and the child who consistently appears with the dirty, unwashed hair, untrimmed nails, or photo. Resistant diaper rash, if the child is very young, it also can have a resistant diaper rash because there is no frequent changing of the diaper. untreated lice infestation. The child comes with a lot of lice. Also, the inappropriate clothing for the weather. The child may wear very heavy clothing during the summertime, or the other may have a short sleeves in a very cold weather. This also can explain that the child is not having the necessary care. Lack of weather appropriate items such as wearing coats, hats, or shoes in the winter time. So nutrition indication, poor nutrition, the child also, because he's not taking enough amount of food in the house, he will ask his parents in the school to give him some food, asking or taking extra food from the other. And when he take this food, he will show an abnormal eating behavior, like eating quickly or hoarding food, as if he is not feeling secure that I need lost this food because I'm not having the ability to access it. And also, the long-term unexposure to food, it can expose the child for having malnutrition, and some malnutrition also can indicate that is corresponding to child neglect. For example, he has low weight, he have a lot of pale pallor, he is weak, he's fatigued, and frequent complaint of being hungry or visible stunted growth. Stunted growth means short stature compared to his peer. Also, it can reflect that he's not taking enough nutrition because of the neglect in the house. Behavior indicator also, for example, the child is frequently absent. His absenteeism is more than compared to his colleague, is much more than his regular colleague, with frequent missing from the school without a valid reason or explanation. A sign of being left home alone or unsupervised. He can, for example, he comes with injuries in the hand, injuries in the lower limb, maybe torn clothes, because this indicates that he has a lack of supervision in the house. Okay, so also sharing that they were alone or they are also taking the care of his other younger siblings or for an extended period. So it can also appear in the form of a developmental delay, falling behind the physical or the emotional or the cognitive milestone. It is due to neglect of the basic need. So how the teacher or the caregiver can help and can detect this form of abuse. So care responsibilities for the teacher, for example, they will observe any change of the behavior or the physical condition of the child, and so they should be very vigilant for the parents, such as frequent bruising, sudden fear reaction, decline of the academic performance. This also can give a clue or can give an alarm for the teacher that the child having a problem. The teacher should be able to note any unexplained change in the behavior, in the mood, the social interaction, such as withdrawal from the class, or abnormal and aggressive behavior. This child may also reflect that he's exposed to aggression and violent behavior in the family. So he is mimicking what he's exposed to. So the teacher should build a trust with the children to encourage them to express what they feel. So they have to work in the items that tell a trusted adult. They should give the sense and give the feeling for the children that they are in a safe environment, and they should trust them so that they can express a form of what they exposed to. So they should provide a safe class environment where the child feels that they are free and they are in a comfortable environment, so they can share their idea and their feeling. The teacher should also use some sympathy and try to listen in a sympathetic way and avoid to give a judgment. You know, your role is to discover, not to judge. Also, he should avoid giving a direct question. For example, he asks the child, does your mother is hitting you? Does your father is abuse you? This is not right. Reinforce the message and the idea that speaking to a trusted adult is safe. You are safe to express what's inside your feeling or in your mind. So the main role and the key responsibility for the teacher is just to document the concerned behavior with the details and the dates. And this record will be submitted to the school agency according to the school agency protocol and administration. he shouldn't make a judgment. The teacher should not make a judgment. He should express his concern that I'm suspecting that the child exposed to something wrong, maybe some form of abuse, and he will notify the administration of the school, for example. Okay, so he should make a plan to help the children to uncover their fear or to provide a form of trust. How can the teacher do that? For example, they can make assignment. For example, ask them to draw what their activity in the house, okay, or in the previous day, or what, how did they spend their time during the last 1 week, or tell me about something you like, or something, draw something you like, or something you don't like. Okay, then the teacher can notice the detail of the handwriting or the hand drawing that, for example, the child may draw himself and draw somebody handling a stick and start to use the stick. This can explain that the child is exposed to a form of abuse. He can also ask a question, for example, but indirect question, not leading a question. For example, what did you have for your breakfast today? So the child can say, oh, no, I didn't have my breakfast, or I forgot to take my breakfast, or my mom didn't give me my breakfast. Okay? Also, it can be asked, for example, how did you sleep last night? He will say, I sleep in the bathroom. This means that he was locked in the bathroom as a form of punishment. This question can provide a clue to the child witness. Also, again, we should not using a leading question. Maybe we use an undirected question that we usually use in the physical examination and taking the history from the patient. We don't give leading question. We use an indirect question. Also, the teacher should be very vigilant and attentive for any abnormal behavior or any sign of abuse or neglect. So, what should the teacher need to follow? For example, he has to observe and document the behavior or the physical sign with the date and the place. He also should speak privately with the child to offer some support. I have to give him the sense of being protected and feeling that he can trust the teacher. And he should report his concern or she concern to the school child protection officer or the local authority. Again, the teacher are not supposed to make a judgment. He will raise the concern about exposure of the child for some form of abuse. And he should also, he did the report, but he also should ensure that the child is receiving the proper care and take the necessary support. So building a supportive environment between the child and the teacher is very important. Create a culture for openness by promoting empathy, kindness, and inclusion. And also we should give some age-appropriate lesson on the body safety. I should give the child a knowledge about putting a barrier, even if it is a child 3 or 4 years. We have to teach the child that you have your own body, nobody is allowed to touch. And for example, even in my clinic, when I want to examine a child, I ask them, I will, for example, I uncover you, your mother is here, and I took her permission in front of the child, and also I asked the child, nobody else is to do such action. I'm doing it because I'm a physician, and I'm doing it in front of your mom. Nobody is allowed to do this for you. This also should be encouraged in the school, that there is a form of body safety and a specific body barrier. Nobody is allowed to touch the child in a specific way, and we should encourage the teamwork among the educator, the caregiver, the counselor, to address any concern in a cooperative way. This is another scenario with the child in the class begin to avoid eye-to-eye contact, a bit very anxious, and was frequently coming to the school with unwashed clothes. This is a form of what? Maybe a form of neglect. So together, the parent, the teachers, the families, and the caregiver, including the health caregiver also, we provide a form of protection. So in the other way, take action for the parent to observe their children. It is very important to have an open communication with the children about their day for the risk of exposing to a form of abuse in the school. So we should encourage them to have a daily conversation, ask them in an open question such as, what was the best part of your day? Okay, what did you like? What did you don't like? Did you anything happen in your day that make you feel happy, or the other way make you feel upset or uncomfortable? This is also very important. We also should create a safe space for the child to share their feeling without fear of judgment or punishment. Many of the kids that are exposed for sexual abuse, they are scared to notify their parent from such experience. They consider themselves they are committing a sin, and this give them a form of fear. We should give the children the feeling that they can express what they feel without feeling of being judged or the fear of punishment. And unfortunately, in our Oriental culture, we don't do that in a proper way. We should change our behavior. We also should teach the children about personal boundaries and the ability to say no if they are exposed to any unaccepted behavior. Also, we have to monitor any sign of distress after the preschool. For example, I can watch any unexplained physical sign like bruising, scratching, torn clothes, or any emotional change, like, for example, unexplained fear from the school, sudden and strict attachment when the mother is sending the child to the school, or reluctance to attend to the school. Also, we should be alert for any behavior shifts such as trouble in sleeping, a bit appetite changing, aggressive behavior, for example, having been waiting or some sucking. Building a relation with the teacher and the caregiver, continuously contacting the teacher, asking about the child and the child's behavior, well-being, development, and also we should be keen to participate in school activity and events, and the parent-teacher meeting and the volunteer opportunity to stay engaged. This also can help to detect any abnormal behavior from your own child or for the other children. Ensure that the caregiver and the teacher are properly trained and understand what the child need to protect, and also the protection protocol. So practical tips for the parent, do and not to do. Do maintain routine checking with the child every day. Observe the interaction between the child and the caregiver during the drop-off and the pick-up time. Trust your internal gut feeling. If something wrong, always give a concern and interest with this feeling. Don't take it lightly that you say that, no, this is not right, I'm feeling wrong. Don't do that. Dismiss your child feeling or concern as trivial. Take it seriously. Assume that the abuse only happened in extreme cases. No, it's occurring in a significant portion in the community. So this is a different scenario when the parent are taking the child to the school. He is refusing to go to the school. Imagining your child suddenly start crying to go to the preschool, something they used to enjoy. He's really happy when go to the school. Suddenly he starts to cry. He don't want to go to the school. So what are the steps what we should take to address the situation? To take when the abuse is suspected, first, report to authority or the child protective services. An important issue not to confront the suspected abuser. Okay, support the child reassurance and professional help. So you have a concern, you either witness an abuse, or if you are concerned about exposure of the child for abuse, then if the person is an imminent danger of harm, then you have to contact the emergency or the statutory services without delay. You have to contact the concerned authority without any delay and write everything down. Reporting, documenting, and reporting is very important. And till this point, your role is just reporting. You don't make judgment. Okay, this is very important for the teacher or the parent that we don't do judgment. We just raise our concern. So if there is no imminent risk or danger or harm for the child, then trust your feeling, always act on your concern. So what you feel to do it. But again, don't make judgment. All the time, report, document, and notify. Within 24 hours, talk to the safeguarding coordinator or the concerned officer. Building safe environment in the school or in the house is also very important. So establishing very strict child protection policy in the school putting camera in different ways, not allowing the one person to take care of the kids all the time, make more than one person in taking care of the young kids, and also encourage the parent involvement in the school activity. So this is a different scenario. The child with sudden behavior changes. Fatma, it's about 5-year-old girl, started to have frequent tantrum and refused to sit near a specific male caregiver at the daycare. She has become anxious about the bathroom visit and avoid physical contact such as hugs or holding hands. So you can just give attention for the place, the bathroom. Why the bathroom? Because the bathroom is a weak point. There is no camera. We cannot put camera in the bathroom. So this will be a safe place for the abuser. Usually the abuser will select the weak point to commit his crime. So what is the possible concern about Fatma behavior and what step we should take to protect her? So we should document, we should separate the child from the abuser, and we should also investigate. And to report for the concerned authority, not only just to report, but also to follow up what done for the child. And here is in Bahrain, we have Market Hamayat al-Tifl up to the age of 18 years, the Child Protection Center in Bahrain, with the telephone number, the hotline is 998, and we have a specific law for the child protection number 57 for 2012. And here is the punishment for any person who exposes a child for punishment. It's either to be in jail or to pay a penalty according to the age of the child and the degree of punishment. For the child less than 10 years, less than 7 years, he will have a prison penalty not less than 1 year, and to pay a financial penalty not less than 300 dinar, or with two punishments together according to the type of the harm committed to the child. If the child is less than 15 years, the prison penalty will be not less than 6 months, and the financial penalty not less than 200 dinar, with one or the both punishment together according to the type of harm committed to the child. Between 15 and 18 years, the jail penalty and financial penalty not less than 100 dinar, with one punishment or two punishment according to the type of harm. Okay, but if this harm is committed a permanent damage for the child or can cause death of the child, the penalty is penalty of being hitting or killing a child or giving a permanent damage according to the case, that it can go up to hanging or up to capitalism. Yes. Okay, so again, this is the 998, is the hotline for the Child Protection Center in Bahrain. We come to the conclusion that together we can make a difference. Early detection and intervention can save life, foster a safe, supportive environment for the preschooler. The rule of everyone, the teacher, the parent, and the community, is to observe, trusted advocate for the children, for the parent, open, proactive, and engage in the child life. Take your role. For the community, be aware, educated, and to unite together against the child abuse. So call to action, speak up of any suspect or abuse. Your action can make a difference. We have to make a collaboration to create a protective network for the children. We have to make available resources and helpline to ensure safety and support. Again, the helpline is 998. Together, we can ensure every child grew up in a safe and nurturing environment. And thank you very much for the different thanks. Thank you. You're welcome, Doctor. Thank you.
Enriching health. This is what the trip.
I have also workshop if you want. I have workshop for the child. This is a lecture. We have a workshop with different.
It's very important for everybody. I know we don't have children, but you have children now. Even for my age, it's very important for the lecture. So if you have more of this conduct, it's much better than rare diseases, which might be that I don't see them. But that's the day-to-day effect Especially for young doctors, they have children, they have to go for the problem. Thank you.
Any question from the audience?
Dr. Muhammad Sabah al Khair, very wonderful lecture and very sensitive subject. And we see the cases, alhamdulillah, not frequent, but we saw them and we keep seeing them. Now, the most important thing, as you mentioned, is diagnosis and to inform. And the most difficult cases we face here, if the short circle of the child is the abuser, one of the parents, uncle, auntie, somebody in the house, grandfather, grandmother, and we are facing a lot of cases nowadays. And according to the British Society of Psychiatrists, 1 out of 10 person is an abuser. That's a huge number. It is a scary number. And this study was done in UK, which is a metropolitan country. So it has all sectors, all nationality, all religion. So abusers are among us, and we have to be aware of them. Let me repeat again, 1 out of 10 is an abuser. Now, if we suspect a child been abused by his short circle, the relatives and the parent, which is happening, hotline, as mentioned, Dr. Muhammad mentioned. Also, there is تطبيق حكومتي, and you can be anonymous. يعني nobody will ask you about your name or your position, and you don't pay any fees. So you can make balagh, you can inform about the case, but you are not required to tell your name, your position, or where are you working, or what's your name. So that's also a protection for the doctors. In big hospitals, tertiary hospitals actually, in Salmania, I saw the hotline numbers are in the emergency room, and this is a reminder for doctors to contact the authorities. In our university hospital, I think with the effort of Dr. Muhammad, we need to establish a guideline if we are facing a child or adult abuse. Let me also explain that in my clinic, I also receive a female abuse, and there is no proper guideline to take care of them. We do it on personal level. We contact authorities on personal level. And there is a center in Bahrain where these women can go directly. يعني once you inform the authority will take them to that house and keep them.
You are talking about the children or the adult, even the adult?
Even the children also, they have a place to take.
Yeah, we have 998, this is the children, but you also mentioned that there is a specific place even for the female adult?
Yes.
Okay, great.
Once you report, the authority will take that female to that safe house. Because if you keep the victim again with the abuser, they're going to abuse them again. So the separation under certain rules in Bahrain, it's available. And if the parents or the relatives of the child is abusing the child would be taken and kept under certain authorities and safe place. So that's.
Yes, thank you, Dr. Farah. You touched a very important place, because many of the patients who presented to your clinic with frigidity is suffering from child abuse in their early life. Yani this is a very important cause. Actually, we did a research 15 years ago, but unfortunately we didn't publish because there was a lot of social problem that we make the sexual behavior for the people who are exposed to child abuse who are in children. And we found that there are 2 groups that reflected their behavior. The first group is the who have sexual frigidity, okay, and the other group is the other side. So this abnormal sexual early exposure, it can be presented in 2 different ways. The first way is either to make a suppression of the physical enjoyment during the normal sexual act with the marriage and with the partner, with the complaint of frigidity, which actually many of the people who have this problem come to you. If you take a history during the children, maybe they will deny, but in their core mind, they will have a history of sexual exposure during early
Wallah,
life.
doctor, if they trust you, they will tell. And
Sure,
I have been told.
Yes,
Yeah,
yes,
if
sure,
they
sure.
trust,
But
يعني
they need a
after,
lot of effort. They need a lot of
yes,
effort to
yes,
make this for you. The other side,
yes,
Dr. Farah, is the abnormal sexual behavior and the adultery. Many of the female ladies who are practicing adultery, they are actually victims. They are
yes,
exposed. They were exposed to in their early life with sexual enhancement. This
yes,
early sexual enhancement, they make early sexual exposure, early sexual experience. It makes the child to be released from their while they are child, and this makes them to enjoy this sexual act during the early childhood, and then unfortunately they practice as adultery.
yes.
Yes.
100% agree. Thank you very much, doctor, for touching a sensitive subject, which all of us we have to be aware of, and we have to be a part to report it if we suspect any case.
Thank you very much, Dr. Farah. I think it's a very good idea that we can just make a guideline for notification when a form of abuse with a child or even adult for sexual or any form of abuse.